Hi everyone, this is Julian again with an update on my chest and the Seromas I was talking about yesterday. I had my appointment with Dr. McGuire, who's a very nice person and is looking for clients to build his top surgery business. I haven't actually seen any of his work personally, so I can't tell you if he's any good or not, but he was really personable and did a great job with the drains. So if you're in the central New York area and looking for someone local, he's definitely somebody to consider. He's with Bassett in Cooperstown and Oneonta. Anyhow, the draining. He wrapped me up in this ace bandage, which I've been wearing since then, and did say that I should stay wrapped. I haven't decided if I'm going to use the bandages. They also gave me a spare, so I can alternate them, but frankly, as nasty as it was getting, the surgical binder may actually be more comfortable. So, I'm almost out of here. They did not put my nipple dressings back on, but I will be doing that before I wrap myself up again. And you see these two little band-aids here are where they put in the drains. Basically, all they did was they took a really large gauge syringe, about yay big.
The needle was that big?
No. The syringe was that big. I've scared my camera person.
Freaking me out.
Okay, the syringe was that big. It was a fairly normal sized needle, I think. And one at a time, inserted them in there, kind of wiggled it around until they found the pocket of fluid and pulled it out. I didn't think to ask how much was removed from each one, but when he was checking out this side, he said he thought it was about 30 cc's, which was what would be about half a drain with the
little plastic thingies.
Yeah, the little grenades. Jackson Pratt drains, that's what they're called. So, I felt so much better afterwards because they really, and I was totally flat at the time. I'm much better now, you can probably see, hopefully, than I was last night. It immediately relieved the pressure on my chest, and I was just like, oh, much better. So even getting wrapped up in the ace bandage after that was joyous. However, I don't know if he missed some or if it started to fill again, but definitely on this side I can feel the fluid in there again, and a little here, but not nearly as bad. So unfortunately, especially with this side, I may have to go back in a few days and have them drained again. But either way, it was completely painless because he didn't use an anesthetic. Said better to have just one hole than two. But I have no feeling here. So because I have not regained my sensation there, I did not feel the needle going in. I didn't feel anything there. The nurses were like, "Are you okay?" I'm like, "I don't feel anything." So I had nothing to complain about the experience. They were all really friendly and polite. And I got to educate them about top surgery and transitioning and other stuff, but in a very respectful and nice way. They had my old name on their records because they're really bad at updating their records. So, but they even fixed that really quickly. Hopefully it'll stick. But other than that, things are going pretty well. Again, there's definitely still some fluid in here, but I'm going to stay wrapped up, which will help because, as I had said previously, I was wearing the binder all day yesterday, and it helped immensely take off the pressure on my chest. The one downside of the situation is they told me to really cut back on movement and exercise. I had been walking 5 miles yesterday, close to 5 today, and they said I should do a lot less than that, at least for the next 7 to 10 days, which 10 days will put me right about 4 weeks post-op, at which point I'm supposed to be able to lift my arms over my head and ride my bicycle and stretch. Obviously, it'll take everything into consideration, but hopefully, cross fingers, by then I'll be sufficiently healed that I won't have to worry about the fluid or muscles and things like that, and I can start to really ease back into my everyday activities in terms of cardio and doing more things around the house and so forth. But in general, things are going really well now that these have been drained. And actually, one really strange thing, he took a look at my nipples and asked me if I got to choose their placement. And after laughing, as Leah has just done, I said, no, I wasn't really awake at the time. And I don't know if it's because he wants to know if this is something he should be discussing with his patients, or if he thought they were funny looking. I mean, from my perspective, they look like they're in a nice location.
They
You
look
can-
good to me.
Yeah, you can all post in the comments what you think about my nipple placement. But I think they're awesome nipples. They look great. And I think the placement is good, so it was just a really amusing sort of question. I'm like, no, I didn't really comment on it. I was out cold. But
They woke you up and said, hey,
Yeah,
what do you think about
exactly.
this?
So, this video's gone on long enough. Keep you updated with how everything goes with the fluid and general healing. So have a great weekend, and we'll see you later.